is no other. Could there be that we the size? No weapon that form against us shall not prevail. No man that rise against us, that war they shall never win. Because I will conquer, oh I will conquer, yes I will conquer them. Come on, let's conquer, oh I will conquer, rise up and conquer them. I am a man, I am a champion, I am a warrior. So who are you to tell me that I cannot make? Who are you to tell me that I am not the greatest thing that God ever created?
Good morning, Grenada, Carriacou, and PT Martinique. You're listening to Hard Talk Grenada. A very special good morning to those of you joining us on the various radio stations: 97.5 CitysoundFM, 89.5 CRFM, 91.9 and 91.5 RealFM Radio, 92.9 Sister Radio Broadcasting from Roseboro, Carriacou, and 94.9 WeiVybz Radio out there in Brooklyn, New York. A very special good morning to those of you joining us on the various media streams, whether you're joining us on Facebook, on YouTube, on Instagram. A very special good morning to you. It is a beautiful, beautiful Wednesday morning in the Spice Isle of Grenada, and we're going to get right into it. With me in studio this morning, I have a very special, I want to say co-host. Every guest I have is a co-host today. A very special guest, Mrs. Anne David Antwine, who formerly sat as Minister for Health. And today she's going to sit with us and talk about vaccination. But apart from being Minister for Health, she has been very well, what's the word I'm looking for, Miss Antwine? Very well situated in the health field, in the health sector, in many different forms and facets. Good morning, Mrs. Antwine. How are you?
Good morning to you, Ms. Duncan. I am well, thank you. And good morning to all the listeners, wherever they may be, all over the world, I believe. And of course, here in Grenada, the Spice Isle, Grenada, Carriacou, PT Martinique, pure Grenada. I'm very happy to be here to join with you in the conversation about vaccination and the situation we're in, and all things related.
All right. Now, before we get into it, tell us a little bit about your experience in the field of health, because most people, when you speak about vaccination and you speak about these kind of intricate things, the first question they want to ask is, well, who gave you the right to be talking about that? You know, what you know about health to be telling us about vaccination? You know, so tell us a little bit about your history as it relates to the health sector.
Okay. Well, I have been in the field of health and education from the age of 17 onwards. I was first in education. Then when I went to England, I went into health. And I've been at all levels of health. I've actually worked in the health field in other countries, apart from the United Kingdom. I worked in the United Arab Emirates. I spent some time in Russia as part of a visiting medical and health team. And just before coming to Grenada, my last job in the United Kingdom was for 3 years. I was a lecturer in health studies at Uxbridge College, Middlesex. Right. I am actually a trained general nurse, a trained psychiatric nurse. I'm trained in the area of special care babies and midwifery and health education and various other things, family planning and various other things along the way. So it's a long history when you think that now I'm many decades over 50. So it's a long history and with a lot of practical stuff under my belt as well as theoretical stuff.
All right, wonderful. So I hope the people listening, I hope that you hear that. So when you ask the question, it's already been answered, right? But we are going to get right into it because the hour just slips away from us so quickly. And this morning we are speaking vaccination. Why vaccination? Why is it important, especially now in the Grenada situation, for as many people as possible to get vaccinated? I know all of us sitting in the room here have been vaccinated and the majority of our family members as well. And now, Mrs. Antoine, we have two options as it relates to vaccination. So we no longer have the excuse, well, I don't want the AstraZeneca anymore, I'm waiting. You know, we now have two options. What would you like to say to the people as it relates to the situation of vaccination in Grenada?
Well, we do a lot of talking, all of us, about vaccinations, but sometimes we need to be reminded about what a vaccine really is.
Right.
And a vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. And as far as the world knows at this time, there is no condition, no disease more infectious than the one we are facing, and we have been facing since February, March of 2020. And in the present time, all the various strains, such as the Delta strain, and maybe even others that may be coming along at this time. That's the reason why we need to know about vaccinations. We need to consider it seriously, but more than anything else, we need to take personal action.
Right. And vaccinations have been around for longer than some of us even remember.
That's right.
Or some of us even know. And we have been saying it here and other places it has been said like a broken record that vaccination is the reason why a lot of us are alive today. We're not living in a world that is riddled with polio or smallpox or yellow fever because of said vaccination. You know, so that is why it is important for us to continue to encourage individuals to get vaccinated. I know there are a lot of pop-up sites, a lot of pop-up activity happening in this week, I believe, from the Ministry of Health. I think yesterday they were in Willis. I'm not sure where they are today, but I could definitely find out for us. Recently, the Prime Minister of Barbados announced that they will not be doing mandatory vaccination. They will not have or introduce mandatory vaccination in Barbados. However, that comes with a lot of fine print. I don't think Grenadians read the fine print when they heard that. They just heard no mandatory vaccination. What are your thoughts on the concept of mandatory vaccination?
Well, the truth is, for every one of us, we shouldn't have to wait on the government, the Prime Minister, the Cabinet, the legal profession, or anybody else to be even debating about whether or not we should have mandatory vaccination. As far as I'm concerned, to save my life, to save my friend's life, to save my family's life, for me, it should be mandatory because I should mandate myself to go and have my vaccination and to ensure that all my loved ones and all those I know and every person, and every person is my neighbor, every single one, it doesn't matter where you live or how far away, I should make it my business to ensure that that person has a personal mandate to go and be vaccinated in order to save the situation we're in. We have to remember, Grenada has a particular history. In 2015, Grenada received a very coveted award called the Henry Smith Award for the highest vaccination coverage in the region.
Wow.
For all the vaccines that were mandated for children at that time in order to enter school and so on.
Right.
So why are we deviating from that history that we have made? We have to remember all the conditions for which vaccination is available. Vaccination is available for polio, and the last case of polio in Grenada was in 1955, the same year as Hurricane Janet.
Right.
A year I never forget because my brother was born in that year. Also for smallpox. We have no measles. The last case of measles was in 1990. The last case of tetanus was in 2007. Congenital rubella and ordinary rubella, they are no longer around. All of these, as you rightly said, are due to the fact that our parents, grandparents, and so on took it upon themselves to ensure that when these things were offered, they mandated themselves, they gave themselves a personal mandate to go and be vaccinated and to ensure that their children, their grandchildren, their nieces, nephews, adopted foster children, everybody in the neighborhood went to be vaccinated because they had seen the suffering.
Right.
We are now seeing the suffering in neighboring islands in the United States. Many of us have families and people we know who have died from this disease. So we here have a responsibility to do so. We shouldn't be waiting on the government to mandate it. And I believe, obviously, all of us have that personal views, and my view is if you cannot and you will not make the choice to take it as a personal mandate, and we have to wait for the law to always tell us what to do, then something is wrong somewhere.
Right.
You know, we're always talking about slavery and this and that and the other. But really, if we become slaves in a condition where the new slave master is now COVID-19, then we need to ensure that we do not become slaves in that kind of situation. Let us go forward and get that vaccination. Let us not wait for government to have to debate, for people to say this, that, and the other, speak about their constitutional rights and all of that. Let us get up, get moving, and get this done. Because our constitutional right is not just about saving yourself, which you will not do in the present situation. Your constitutional right makes you a Christian to help other people to save themselves.
Right. Now, as a former nurse, and we're speaking to, I believe, now healthcare professionals. We're speaking about nurses and doctors and so on, that may be reluctant in getting vaccinated. What risk does it directly pose to them? And of course, their direct risk is our indirect risk as a nation. What risk does it pose to all of us, them not getting vaccinated?
Well, the risk it poses to them is the same risk it poses to all of us. Serious illness and death. As far as the nation is concerned, if health professionals are affected by a condition, in this case COVID-19, then it means that these people who are caring for us are not available to care if we get sick from whatever reason. Let us take a practical situation. We are sitting here in this room this morning. Just imagine one of us suddenly gets a case of appendicitis,
Right.
for example, and that person has to call an ambulance. If the ambulance would normally take 5-10 minutes, you know that ambulance can take hours. You know why? Because there'll be less ambulance drivers available because they're ill with COVID-19 or they've been exposed to it.
Right.
The nurse accompanying the ambulance driver to come to pick you up or pick up whoever the person is not available because she's unwell. You get to the hospital to casualty, if indeed you can get into casualty with all the other cases and people that are there. What is your situation? So it is compounded by that kind of thing. We all know in Grenada, for example, the situation with things like hypertension, diabetes, asthma, cancer, all of those other conditions that perhaps a lot of people are walking about with and they're not even sure.
Right.
You suddenly get up one morning and you're feeling ill or whatever the reason and your blood pressure is sky high. There's nobody to look after you because the nurses are tied up with COVID cases or there are fewer nurses and doctors on duty. The laboratory cannot cope because they have too many cases, too many tests to be doing for those situations. Beds are not available and you know, it's a circle, it's a cycle that continues around. So when we're saying, oh, there is no COVID in Grenada, oh, I won't get sick, I'm wearing my mask all the time, which we all must do. So you don't really care about being vaccinated. We need to look at the very bigger picture. And the bigger picture is what will happen down the road when the numbers continue to rise.
Okay. Now, the World Health Organization has recently announced that getting ill after getting COVID or getting ill with COVID-19 after getting vaccinated is very possible, but it is rare. And the symptoms, of course, would most likely be mild symptoms of COVID-19. They further went on to say that breakthrough cases of COVID-19 after a vaccination usually happen before the body has time to develop maximum immunity. Now, I want to bring that into perspective and give an example of that in a recent case that we had here with an entertainer who came from the US, had gotten his vaccination with Pfizer. And it was just about 2 weeks after getting the vaccination that he came here and was tested positive. Now, that is a very interesting case because it kind of speaks about what the World Health Organization is referring to, where you get vaccinated and you think, oh, well, I'm vaccinated, so I am now immortal when it comes to COVID-19. I am fully immunized, so I no longer have to follow the protocols, or I no longer have to take into consideration the fact that COVID-19 is still there. So I'm just going to do what I need to do. I'm not going to wear my mask. I'm not going to, do any of these things. And then you get a breakthrough infection. Which simply means that you get COVID-19 on a lesser scale because your body hasn't built up that immunity that it needs to really fight off that strain. What would you say to vaccinated individuals within the state of Grenada who feel like, well, I've been vaccinated, I've done what I needed to do, I don't want to have to wear masks, I don't want to have to social distance anymore because you guys asked me to get vaccinated and I've done it? What would you say to these people who feel this way?
Well, what I will say to these people is what I say to myself every day. I've been fully vaccinated a few months now, but every day you follow the protocols as they have been prescribed by the Ministry of Health and those scientists and those who are professionals in the field. Because as we have been told by the scientists repeatedly, those who are in the know, those whose profession it is, those who work in this field 24 hours a day, many days and months now, that you can have the condition, but of course it will be milder, but you can also spread it to other people while you have it. So you need to be sure you are protecting yourself from death, you are protecting yourself from going on a ventilator because you've been vaccinated and you're building up your immunity. But if you happen to not follow the protocols and you pass on that to other persons, then of course the other people will be suffering. So we need to follow the protocols. We need to be sure. We need to say, yes, I am protected from a serious condition. I am protected from death. But I must make sure that I do as I am supposed to do.
Right. Now, we have now the Delta variant, which is a variant of concern internationally because it seems to be wreaking a lot of havoc. It's been spreading like a wildfire, for lack of a better analogy. It's spreading like a wildfire. They say it's 50 times more infectious, right, than the other detected variants of concern, which means that not just vaccinated people, not just unvaccinated people should be concerned, but vaccinated people as well, because we still have to take into consideration breakthrough infections. I really don't want to say that I don't believe Grenadians are taking it seriously, but I don't believe enough of us are taking this seriously.
Yes, I think you're right to put in that enough before, because of course there are quite a number of people who are taking it seriously. But we need more people to take it seriously. We have heard and we know the meaning of herd immunity. You need a certain percentage of people within the state of Grenada, in the population of Grenada, to be vaccinated so that other people are protected likewise. And those may be people who are genuinely unable to have the vaccine for reasons that the medical profession have told them for whatever. And those are very, very few people. So in fact, if all of us can be vaccinated, then it is much better for the whole state of Grenada and for anybody who is visiting us, relatives and so who are wanting to come for funerals, for weddings, for whatever, all of those kinds of things. So we just need to keep, be on our toes, keep spreading the word, keep encouraging people. I know that it could be very discouraging, very distressing for those people who are working in the field, those of us who are trying to spread the word, because people seem to be coming up with one excuse after another, one reason after another. Most of them, well, all of them, totally unfounded. So they're trying to convince and to tell people and to encourage them and to show them the truth and to meet with these stumbling blocks is very discouraging. And all of that can be avoided if people just listen to the science, listen to those who are in the field, and go ahead. Remember, those of us who are there trying to say reasons why we should not be vaccinated, you have to remember that your parents, your grandparents, they had a lot less education than yourselves, but they took it upon themselves to ensure that you were given polio vaccine, you were given all the other vaccines that were available in order for you to go to school, for you to be alive now, so that you can make all these noises about not getting vaccinated. You know, prevention, we know, is always better than cure. And in this case with the Delta vaccine, what we are seeing and what the world is showing, what the statistics are showing, is that there may be no cure for a lot of people in the present situation.
Okay. Now, recently we have, and I may probably just be jumping through the questions because I want to try to get as much in within the hour. Recently, we have seen persons on social media. They have been encouraging individuals within Grenada to use two very specific drugs. One, ivermectin, and the other one, hydrochloroquine. Now, hydrochloroquine, we might be very familiar with that name because very early on the onset of COVID-19, there was research and persons using hydrochloroquine to try to treat the symptoms of COVID-19, not COVID-19 itself, but the symptoms of. That has since been disbanded because what doctors were finding and scientists were finding is that the side effects of this drug were doing more damage to the individual than actually helping the individual deal with the COVID-19. And I have seen on social media many individuals saying, oh, well, that's an alternative. How do I get it? And it's funny because you're looking at a situation where they don't want to get vaccinated because they think the vaccine was created too quickly. They heard of side effects of the vaccination, which has scared some. They don't know what the ingredients are, so they are skeptical in using the or getting vaccinated. But here you have people very openly, without research or without proper research, encouraging the thought of using these drugs. Now, I want to just quickly share with some individuals or those of you who are listening some of the findings, right? We have the ivermectin, which, by the way, is an anti-parasitic. It's a veterinary drug, you know. It's a drug that they use on animals to get rid of parasites. And here you have individuals within Grenada who are very keen on trying it because it keeps them, or it helps them to support their cause of not getting vaccinated. You know, and it's very unfortunate because we're doing more harm to ourselves than good.
Well, I wouldn't say that they're not doing their research, you know. They're doing their research, but they're looking in the wrong places.
Right.
That is what it is. They believe that they go on social media and somebody says, John Smith or Mary Thomas or whoever it is, you know, John Public, says this and that, and everything that's put on social media is gospel, except the gospel.
Yeah. And I want to share quickly the side effects of the ivermectin first, and then the hydrochloroquine. The ivermectin, taking this drug, the side effects, of course, you can have an allergic reaction, difficulty breathing, swelling of the face, the tongue, and the throat. And this is common in all medication that you take. Because remember, we're dealing with different individuals, different bodies, different immune systems, different reactions. So people will react differently to different drugs. Just as you, Mrs. Antoine, may be able to take penicillin, I know I cannot because I will die. In the same way, all medication is Probably not for everybody. You just have to know what you can and cannot take. But apart from that, you can get eye pain with redness of the eye, puffy problems with your vision. You can get severe skin rash, itching, or rashes with pus. Confusion, change in your mental status, balance problems, and trouble walking. Fever, swollen glands, stomach pain, joint pain, swelling of the hands and feet, fast heart rate, trouble breathing, loss of bladder and bowel control, neck and back pain, seizures, lightheadedness, or even fainting. Common side effects are headaches, muscle aches, dizziness, diarrhea, and a mild skin rash. Now, these are all listed as side effects of this drug that you are very willing to try, just because you don't want to get vaccinated.
Well, I sincerely hope that the number of people who are even considering trying that medication or that drug is very, very small. And I sincerely hope that now you have pointed out very clearly what these things are, that they will not be doing so.
And I also want to share with the people who are thinking about hydrochloroquine, because I even heard somebody outrightly state that people in Grenada have been treated with hydrochloroquine to deal with COVID-19. I would like her to present statistics or proof of that, because sometimes we often go out there and just say all kind of thing as gospel. But apart from the side effects of hydrochloroquine, there are certain things that you cannot be taking, or certain medications that you should not be taking while you are or if you're considering hydrochloroquine. If you are on insulin, so that means if you are a diabetic, you cannot take hydrochloroquine. If you are on methotrexate, that's an immunosuppressant, you cannot take it. If you're taking seizure or heart rhythm medications, you cannot take hydrochloroquine, right? But apart from that, there are many, many side effects of this drug. And I'm trying to pull up the side effects here. It's not as accessible as the other one. There we go. And the list is so long, so bear with me. Side effects: blistering, peeling, or loosening of the skin, blurred vision or other vision changes, chest discomfort, pain or tightness, cough or hoarseness, dark urine, decreased urination, defective color vision, diarrhea, difficulty breathing, difficulty seeing at night, dizziness or fainting, fast pounding or uneven heartbeat, feeling that others are watching you or controlling your behavior, feeling that others can hear your thoughts, feeling or seeing or hearing things that are not there, fever with or without chills, general feeling of tiredness or weakness, headache, inability to move your eyes, increased blinking or spasms of the eyelids, joint or muscle pain, large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, feet, and sex organs. So basically everywhere swelling. Loss of hearing, lower back or side pain, noisy breathing, painful or difficult urination, red irritated eyes, red skin lesions, often with a purple center, severe mood or mental changes, sore throat, sores, ulcers, or white spots on the lips or in the mouth, sticking out of the tongue, stomach pain, swelling of the feet and lower legs, swollen or painful glands, trouble with breathing, speaking, or swallowing, uncontrolled twisting or movement of the neck, trunk, or arms or legs, unusual behavior, unusual bleeding or bruising, unusual facial expressions, unusual tiredness or weakness, yellow eyes or skin, drowsiness, dry mouth, increased thirst, loss of appetite, mood changes, no pulse or blood pressure, numbness or tingling of the feet or lips, and consciousness?
Well, when you consider that list of side effects for those medications that are not prescribed or given or used to treat COVID-19, when you consider that, as opposed to the few things that are possible that have been seen with a vaccine, it's really, there is no competition.
Absolutely no competition.
Because
Absolutely.
with the vaccine, you may get some redness on your arm at the site of the injection. You may get your arm maybe a little bit sore for a day or two. You may feel a little bit listless, that is kind of without any energy, those sorts of things, but nothing as severe as that. And when you think what the long-term effect is, just to have something as mild as that to save your life and to save the life of the people that are close to you and those you are mixing with on the bus, in your workplace, in your church, in your community, on the sports field, we have to say that, the choice should only be to go and have the vaccine and follow all the protocols which have been proven to work.
Absolutely. Now, recently we have received Pfizer, and Pfizer has been noted to be used in children from 12 to the age of 18, which is actually a wonderful, wonderful thing, because so many of us parents have been waiting for this day. And I want to give my example before I let you speak on it. My daughter is immunocompromised. She has 2 autoimmune diseases, and it was a very difficult decision in trying to figure out what do we do with her in a COVID environment, because she's on methotrexate, an immunosuppressant, which means that she's basically functioning with less than active immune system. So it was a difficult decision in trying to figure out what do we do. And then we heard of Pfizer coming to Grenada, and immediately, even before it arrived, I called her doctor in Barbados, and we spoke to the rheumatologist in Miami, and he was like, as soon as she can get vaccinated, do it, because it is necessary. Her risk when it comes to getting COVID-19 is so much greater than the average individual that you don't even want to take the chance. So on Monday, I brought her. She got vaccinated along with her brother. And I must say, they had no side effects. Right. None whatsoever. Right. They had a little pain on the injection site, which was expected. But apart from that, there was no fever. There was no listlessness. There was nothing. They were fine. I stayed with them for the entire day yesterday to monitor, to see how things were going. And they were good.
Well, that's exactly what we have been saying, because as you may know, I'm also the chairperson of the Grenada Sickle Cell Association. And that's what we've been saying to the adult sicklers when the AstraZeneca vaccine only was available. Because we do know that one of the things that happens to them, obviously with blood clots, with their chest being compromised and all of those sorts of things. And the advice that we are given by the medical profession at the highest level is that they need to go and get vaccinated ASAP. Now that it is available for the children from 12 years onwards, then the advice to their parents is exactly the same. Because if they are not vaccinated and they happen to get COVID, and we do know that there is, one child at least in Grenada that has COVID, that has been tested positive for COVID.
Right.
And if that child has any other condition that is affecting their medical situation, then this is time. Because once you get COVID and it affects your lungs, you hear in some cases with people who had COVID that they can almost see a hole in their lungs.
Wow.
That, with what they suffer with that condition. Because, people on ventilators, they cannot breathe, they're struggling to get a breath, and all of those things, which, it's really like living hell.
Yeah.
I mean, if anybody has asthma, you know what it's like when you cannot breathe. Yeah. Can you imagine asthma 6 times over almost? You're on a ventilator, you cannot breathe, nobody can come to visit you. If it comes to the state where the doctors and the medical staff, the nurses say we can do no more, All you can think about, those you are leaving behind, the guilt there is, and the fact that unfortunately you are going to die alone.
Yeah.
And we do not want that to happen. Grenada only has 110,000 people. I know we're starting to do census very soon, to do a recount as happens periodically. But we cannot afford to let this happen, because some of us are afraid of a needle. Some of us are afraid to go. Some of us have every excuse why we cannot go from here to there to save our lives and to save their lives. As Pope Francis rightly says, vaccination is an act of love. It's an act of love for yourself, and it's an act of love for all persons in your circle, in your community, in your country, and in the world.
Yeah. I just want to read a comment on the live video. It says, my brother-in-law died within 6 days of contracting COVID-19. His wife is still in the hospital fighting for her life. This is serious. Took my 2 doses on the second, and on the second one I had a little chill. I am now a senior. God bless the people of Grenada. You know, and you mentioned something very important here, that before I say that, I just want to reiterate that COVID-19, the vaccination is not meant to keep you from getting COVID-19. There's no 100% surety that you're not going to get the virus. However, research has shown, and we keep getting data because we are living it now. We are living now where persons are vaccinated, and we have a variant that is ripping through our world, the countries. And you have data where people who have been vaccinated, some of them, yes, they've contracted COVID, but they are at home dealing with the symptoms. You have less people dying as a result of the amount of vaccination that we have done, even now with this variant that is going. And even when you look at hospital statistics, it would show you that 90% of the persons who have been admitted to hospital, and even people who have contracted the virus, are unvaccinated individuals, you know. But further from that, you have to take into consideration, by putting yourself at risk of getting COVID-19, you don't know what's going to happen. You don't know for sure, you don't know for a fact that your immune system is going to be strong enough to deal with COVID-19. You do not know for a fact that you are going to be strong enough to handle the symptoms of COVID-19. Now, you end up in a hospital, and look, as the individual say, 6 days of catching COVID-19. This person died. There was no long period of suffering. There was no, okay, well, I know my brother has COVID, so I have at least 2 weeks with him, 6 weeks with him. There is not that period. And on top of that, you can't go and visit them. You can't hold their hand. You can't, give them a final hug. You can't say a final goodbye.
It's easy because we say the person knew 6 days before the death that the person had COVID. Yeah. But they might have had minor symptoms before they were diagnosed. And in that period of time, they could have passed it on to other people. So we always have to be sure that we take every precaution with the protocols laid down, washing hands, sanitizing hands, doing all of those things. 6 feet distance, wearing a mask constantly in public, whatever. All not crowded with crowds of more than 20 people as designated by the protocols in Grenada, and so on. And just to confirm and to reiterate and to stress again what you've just said, the statistics have clearly shown that the deaths that are occurring in those countries where there are a number of deaths are mostly to unvaccinated people.
Absolutely.
To unvaccinated people.
Absolutely.
And what we are seeing, and people are reporting over and over, is that people on their deathbed are begging to be vaccinated.
Yes.
And at that time, it is too late.
Yes.
Because the vaccine at that time cannot have time or cannot build up the immunity that you need, because at that time, most of your organs would already be in the very last stages.
It's really sad that we are in a place of so much uncertainty when it comes to COVID-19, and yet you don't see people rushing to get vaccinated. You don't see people rushing to protect themselves. And I don't ever want us to be in a situation where we have to say, well, if I had known, you know, or we are in a situation where our health, look, just in the Bahamas, they're on the verge of a healthcare crisis because they have so many cases. The Bahamas, who was dealing with COVID so well for so long, you know, and it only takes but just a moment for COVID to infiltrate your society and create chaos. And I don't think we're taking time to understand that. We're focusing too much on who lie. We're focusing too much on who said what. We're focusing too much on the conspiracy theories. We're focusing too much on blaming one another. And we're not focusing on the fact that it just takes one moment and one mistake.
Absolutely. Absolutely. And I mean, all of us are human beings, so any of us can make a mistake at any time. But if we do make a mistake, then we say, yes, the mistake has been made. This is not what should happen. This is what you should be doing. And you get on and do it. Let's each of us take personal responsibility. I think this is what is important now.
Yeah.
As a parent, you took the responsibility of taking your son and your daughter to be vaccinated. All persons who are parents take the responsibility, because you can't just let your 9-year-old go to a vaccination site to be vaccinated. You can't just say, well, go on, they're doing it down the road, when you are sitting at home and you yourself, you are not vaccinated. I mean, I heard a mother saying recently, I don't know what's in this thing and I'm not letting it put it in my 4 children. Well, you have to remember that if your child gets COVID, goes to school, and the teacher contracts COVID, even if the teacher is vaccinated and has some symptoms because they get it lightly, then that is the end of that school for a period of time. And you want your children to have an education. We don't want to be reaping the negative effects of our inaction in the next 5, 10, 20 years.
Yes.
We want to stay on top of things.
But further from that, the fact that individual, I'm assuming that child goes to school. The fact that child goes to school means that child has been inoculated a few times. And I'm quite sure that mother never once asked, even when the child was being vaccinated at 6 weeks, never asked them, well, why in that vaccine? I'm sure we don't even know what our children are vaccinated for at 6 weeks. Some of us don't even care to ask. We just know that they said that at 6 weeks, we must take our child to the health center and that they must be inoculated. And then we know that before the child enters the primary school setting, they must also be inoculated. That is what we know. That is you can say that is our culture because everybody does it. You have a child, you bring your child to be vaccinated and that is it. But even for those parents here, and I'm not sure there are many, or any at all, because I think it is in law that your child must be inoculated before entering a public school. Any school, public or private. That even if that person decide, okay, well, I'm not going to vaccinate my child, the hundreds of thousands of parents who have vaccinated their children is protecting your child, because what vaccination does, and I think people don't understand this, what vaccination does, I have polio, I am vaccinated from polio, you have polio, you are vaccinated from polio, Mr. Bola has polio, he is vaccinated from polio. That virus can jump from me to you and get weaker, from you to Mr. Bola and get weaker, and that is what it does. It's weaker until it dies out. And I don't think people understand that, and that's why we have no polio, that's why we have no yellow fever, that's why we don't have these things running rampant in our society, because there aren't any rampant strains of it, one, and there are more people vaccinated against it, so it really has nowhere to go.
Well, people need to realize that is so. And of course, it is mandatory for entering school. And, people take a lot of pride in dressing their children in their uniforms, seeing them go to school from preschool and move on and so on and so on. But I guess at some point, every action has some kind of reaction. People might say, well, why is there perennial larceny team, for example? Well, there is, because there's perennial larceny. So if now people are not going to consider having that vaccine to save themselves and to save the country and save the world, then at some point, the Public Health Act and the act that controls vaccination will have to be looked at again to perhaps change the ages. Maybe it will have to say any infectious condition that arises, that all children must be mandated while they're in the school system until they reach 18, or maybe all vaccinations for whatever. So that is something that will have to be, I imagine, that will have to be considered to be put into place, because now, as we said, there are all those vaccinations we are considering. Now we are up to HPV, which is really a choice at the moment. But after that, there has to be things, so all of these various other conditions like COVID and so on that are coming on stream and that are spreading like wildfire. And if people will look and they will think, every time there is a new condition, a new illness that comes, it is more vicious than the ones before. Every single one.
Of course.
And people have to consider that actions have to be taken to deal with those things. And for those people who are hesitant because they are saying, oh, this vaccine was prepared and it was made so quickly, all other vaccines took years. The kind of science that exists now, the sort of models and so that your very children are building at TAMCC, the things they are doing in the chemistry labs and so on. We were not doing them. You were not doing them at school. So things are moving on. Science, innovations, and so on are moving on. And there's always a base from which to start working.
Yes.
So when there is a new vaccine, a new condition, there's already a base from which to move.
Absolutely.
So it takes a lot less time. And of course, there are a lot more people in the field of science now of all nationalities, including some very prominent Grenadians in the field of science, to move on and to work. And I just want to put a word of caution here because I've seen it happen. There are a lot of people who would say to people, well, it's your choice. It's your constitutional right. You don't have to have it. But I tell you, if you are a fly on the wall and you look, you will see that some of those very people who are telling you that, don't fool yourself, they already had their vaccine.
Oh, yes. Oh, yes.
They already had their vaccine. And if you look at it, if you go to the vaccination clinic, you would see that a lot of the people that we are saying, and that perhaps we know because of color and creed and what have you, have suppressed our people in the past. If you go to a vaccination site anyway, you would see that they're in a majority,
Yes.
because they're taking the action to protect themselves and protect their lives. So why are we doing differently? Let us, people, let us sit up and think. Let us sit up and act. Let us take the necessary action, because Grenada belongs to all of us and all of us who are here.
Absolutely.
There is also another argument that is going on. People are saying, it's them that are bringing it here, close down the country. Now, when the country is closed down, there is nobody available to collect the money that is sent to you at DHL or whatever the other, Western Union and so on. There will be no boat to bring in any barrels or boxes that are sent to you from overseas.
Yes.
There'll be no people on the port to clear those boxes because the port is closed down. The workers are sick with COVID because they have not been vaccinated, and everybody is unwell, and all of those things. Singers, we all love some of our very prominent singers in the country, and artists and all of people in the various fields. And, they are being stifled because they are not getting the opportunities to go out there, to entertain, to earn $1, to do what they need to do because of this COVID and especially this Delta variant. So if we are not vaccinated in our numbers, if we don't show that act of love, then we are doing a great disservice to everybody. There are holes in the road. Why the government doesn't do anything about it? I have never seen a tree in Grenada called a money tree. I have seen mangoes. I've seen sapodilla. Somebody even sent me some pork and pork the other day and some what have you, all of those. But I do not think that the government of Grenada, whether the present government, past or future governments, will ever have a tree that they just shake for money to come. Money only comes into the treasury to provide schools, to do the roads, to do all of those when we have normal commercial activities in this country.
Yeah.
the person who is selling barbecue to make a living, those who are sending crops to Trinidad and trading and all of those. All the stuff that we see being sold, deodorants and toiletries and adult pampers and all the things that are being sold, they are not going to be able to come. And life could be extremely difficult if we get to a situation, and that is what it is. It is about prevention.
Yeah.
It is about care, and it is about taking action one person at a time.
Yeah. That is.
Yeah, one person.
One person at a time.
I don't think the case can be laid any more basic. It can't be any, it at any level, no matter how you look at it. We all know prevention is better than cure.
Yep.
And a stitch in time saves nine.
Yep.
A stitch in time saves nine.
A long time I didn't hear that. A stitch in time saves. But you're absolutely right. It's all about personal responsibility, what you are doing to help combat the situation, what you and I don't even want to say what you have done to contribute to the situation, because that would be pointing fingers, and at this time I think we've passed that. I think at this point what we need to do is, or need to speak about, is what am I doing? Not what Miss Mary and Mr. John or Pastor James, full of people in his church, or Mr. Smith down the road have fed by his shop. It's not about what other people are doing. It is what you are doing. And I think if every single person within the state of Grenada accepts, realizes, and practices on their personal responsibility in fighting COVID-19, then we would be far ahead in dealing with this scourge. And of course, you have responsibility for your family, your children, those who cannot make decisions on their own. You have a responsibility to them to ensure that they as well are following the protocols. It's not just about getting vaccinated, It's about following each and every protocol that comes with COVID-19. The washing of hands, the sanitizing of hands, the social distancing, the wearing of masks properly, not just wearing masks, but wearing of masks properly, because I never see a chin breathe yet. So I don't know why we are so keen on wearing our masks below our chins and protecting our necks. I've never seen any of those things breathe yet. So wearing of masks properly, and just understanding and realizing what your personal responsibility is. Eating properly, boosting your immune system, and making the necessary preparations for this foreign invader that is COVID-19. But we are out of time. Do you have any final words that you'd like to say to the people?
I would like to say, I'm a confirmed Christian, a Catholic, in fact, and I make no bones about saying that in public. But I where people say, God is my vaccine, God is my healer, we have to remember, because that is an argument that is being put forward. We have to remember that God is the one who gave each of us our talents or abilities to do whatever. So if God gave you the talent to be a scientist, God gave each of us the talent to read, God gave us the talent to act, and God also gave us choice. That is one of the most important things that has come to us in Christianity, in life, through the Savior. And so just sitting and saying, well, God is our vaccine, because God has given somebody, number of people, men and women, the ability, the vision to produce the vaccine to help his children. Absolutely. Because we are his instruments, we are his hands and his feet, and that is where we are doing. So people, when I pass by wherever a vaccine thing is, I really want to see a long line of people standing 6 feet apart with their mask above their chin, their noses, and their mouths, waiting to be vaccinated, and then going and carrying on all of the other protocols, washing and sanitizing their hands. We know the pleading and the begging is going on and on and on. We want to take action. We want to see this. We want to get to the fact where, as in 2015, Grenada was at the top of the chain for the best vaccination statistics in the region, that we get there, and we get there as soon as possible, sooner rather than later. Thank you. Have a good day.
All right, guys. Before we close off on the program, I just want to let everyone know that Pfizer and AstraZeneca COVID-19 vaccines are available. In order to get inoculated, you can go to the Karani James National Stadium, Gate B, on, today's Wednesday. So Wednesday, Thursday, and Friday from 9 a.m. to 2 p.m. On Thursday, you can also go to SAMS, the St. Augustine Medical Center, from 12 to 3 to get inoculated there. The vaccines are also available at all health centers, but please, as we advise with getting tested for COVID-19, please contact your health center first and let them guide you. If you are thinking about getting inoculated and you don't want to go to the stadium, but you want to do it by your healthcare center, please speak to a nurse there and they will tell you what the best day is or time is to come in. If you think that you have symptoms, and this is very important, that you have symptoms of COVID-19, but further from having symptoms, if you believe that you have been in contact with someone who has been tested positive, please get tested. It's not just about you showing symptoms, because we have asymptomatic people in our society, but it's about taking ownership for the fact that you may have been exposed to COVID-19. I beg of you, call your nearest health facility and let them come and test you. Testing is free. You don't have to be afraid of the fact that, I went and jumped up, so they're going to charge me, so I ain't calling nobody. I will just sit down inside 14 days and hope I don't have COVID-19. It doesn't work like that. Get tested. Know your status. I know we usually just say that for HIV, but no, it's COVID-19 too. Know your status. You could be well at home, feeling good as gold, and COVID-19 positive and infecting the people around you. So please get tested if you know you have been exposed. Guys, we have come to the end of our program here for today. And as we say here every day, in whatever you say and whatever you do, be safe and be secure. We always want to be talking with you, but we do not ever want to be talking about you. So please do enjoy the remainder of your day. Stay safe, be responsible, and do the right thing. Get vaccinated. It's been a pleasure, guys.
You're listening to Hard Talk Grenada via www.hardtalkgrenada.com.
He saw that it was his son, who was pointing and laughing at him.
Hi, I am Emmeline Pierre, Public Relations Officer of the New National Party. Making important decisions always difficult. But I made the wise choice to take my 2 COVID-19 shots. In making important decisions, it's always important to go back to the why. Why did I take my shots? I took my COVID-19 vaccine shots to protect myself and to protect everyone around me. But most importantly, to protect the people I love dearly.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy.
To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal.
When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.